Hello, welcome to MedLife Scoop's Dr. Uli Chettipally. It's a privilege to have a distinguished healthcare innovator and trailblazer with us today. Your pioneering work in emergency medicine, digital therapeutics, and physician innovation is truly inspiring. We are eager to delve into your journey and the groundbreaking advancements you have brought to patient care. Welcome, Dr. Uli Chettipally.
Thank you very much for having me. It's a pleasure to be on your podcast.
We are privileged. And to start with, we would like to, your journey in healthcare innovation is a testament to your pioneering spirit and dedication. Our listeners are eager to uncover the lesser known stories that have shaped your path. And if you could share 3 pivotal moments or experiences that have deeply influenced your innovation approach in healthcare.
Sure. I would say one of the big things that happened, I was growing up in India and also, looking at medicine as a career choice. I was fascinated by science in general as a kid. I always wanted to be an inventor and a scientist. But when you're growing up in India, there are mainly 2 choices, a doctor or an engineer. So I was not very good at maths. So I picked medicine, hoping that, I don't need to deal with it. But so that was a pivotal moment where I felt that, picking medicine as a career choice, mainly because, there's so much science that goes into medicine, which we have kind of put it on the side and created a separate track for research and academia. But if you think about it, a lot of the treatments and new discoveries are based on science. So that was the first choice I made, which was a pivotal moment where I went into medicine. The second, I would say, the choice was, whether to stay in India or come to the U.S. So a lot of my friends at that time were going and taking this ECFMG exam, and so I said, okay, let me try. And I went and I passed, and so that's when I decided, okay, I'm going to pursue medicine in the United States. So I came here and to Los Angeles and got into a research fellowship looking at hypertension. From there, emergency medicine. From there, came to my first job in San Francisco Bay Area. Over there, I got into, I also did a master's in public health and epidemiology and population health at UCLA. So that helped me get into a job, on the administration track, became the chair of the department, ran the department for several years in South San Francisco, the emergency department. The next moment came when around 1999, 2000, that's when the dot-com boom was happening. Some of our friends, came together and asked me, hey, shall we do a startup? So that's when I took a year sabbatical and joined them in the startup. And so that was very exciting. We were able to raise money and build a product and all that great thing. And so I really got hooked to that. Number one, doing technology, understanding the power of technology. And number 2, that you're able to start from scratch and create something that was not there before, creating something of value. So those were great lessons. And also it was a pivotal moment when I realized, wow, this is where, I need to focus the rest of my career. Although that company, crashed with the market, but, that appetite for innovation and appetite for building something new and entrepreneurship started at that time.
Beautiful. So a boy from India who took medicine with the purpose of not using it came to the heart of innovation in the world, which is Bay Area, San Francisco, and started innovating. So beautiful. The story of
Thank you.
how the life pivots and directs you in the direction, or I always feel like life directs you for the purpose you came on this earth, which we don't realize sometimes. But these moments are the one that shape and directs you to that purpose. And your purpose is serve people, patience
Yes.
with your innovation. So beautiful. To continue
Thank
that,
you.
from the initial days, with your extensive background in emergency medicine and clinical decision support, what was the defining moment that inspired your transition from practicing medicine to pioneering healthcare technologies like robotics and virtual reality?
Yes. During my days, so once I realized the power of technology, and then at that time, the company I was working with, they they implemented EHR, electronic health records, right? So there were some of the early pioneers in EHR implementation. And what I realized is that the amount of data that was going into EHRs was so huge, and this was the early days, but people haven't realized how much valuable that data is. And so that's when I pivoted from administration to research, mainly technology-based research, looking at data, looking at clinical outcomes. And so I started a group called CREST Network, which is an internal group within Kaiser Permanente, where I was working at that time, and recruited physicians and physician scientists who are interested in research, emergency physicians. And so we had a nice group, and the main purpose for that group is to use the data that we are collecting in the EHRs and be able to look at clinical outcomes and how can we improve that. So naturally, I became the technology lead because I had some experience with technology. And so what we did there was I designed a system, a platform that would sit on top of the EHR. They had Epic over there. So it would sit on top of the platform and pull data from the EHRs, large amounts of data, thousands and hundreds of thousands of patients, and then analyze it, and using that to predict outcomes for patients. So if you look at historical data from patients, you can see, okay, so which patients are going to have bad outcomes, and how can you prevent that from happening, right? And so we designed a system where, this will automatically go in there and look at the data, look at the outcomes, and predict what is going to happen with the patient that you're going to see next in the emergency department. So based on that, the system would also recommend options, treatment options for the physician to consider. For example, this person with chest pain, the likelihood of this person with chest pain having a heart attack in the next 7 days is 0.003%. So you don't need to do any further testing. You can send the patient home, have them follow up with their primary care doctor. Or it'll say, this patient, is in, there's, 2% chance that this person could have, a cardiac event in the next 7 days. So you better observe this patient for 12 hours or whatever. So that kind of guidance, very granular, very specific, and very actionable. And all this happened within a minute or two at the point of care in real time for each patient that came into the emergency. And so we studied that and compared that with patients who do not have this system, or physicians who do not have access to this system. So 10 emergency departments had the intervention, the other 11 emergency departments did not have. And we followed these patients to see if there is any difference in the outcomes. And we were pleasantly surprised that it really worked. The length of stay decreased in the emergency department. The number of tests that were done has decreased. The admissions decreased, and patients were having better outcomes because we were also alerting the higher risk patients that you would normally not recognize. And so it's a win-win-win situation for the physician, for the patient, and also for the organization, because it's being a value-based care organization, it's good to optimize the care to the patient rather than overdoing things. And so I would say that was the pivotal moment where I thought about an idea, implemented it, and tested it, and actually saw the results. And that was very gratifying for me, that, oh, this is possible. The reason why I started InnovatorMD is because I've seen, with all the experience I had, with all the connections I had, with all the influence I had in the system, I still had a tough time convincing people that this is the right thing to do, right? It took me about 6 months to build the system, but it took me 18 months to get approvals, even though I was inside the system. So imagine if somebody wants to bring in an innovation from outside, it's nearly impossible. And the other problem I saw was that physicians and other people who are on the front lines, they see problems firsthand. And these, physicians are very smart individuals. They are very dedicated, to improving care, and they spent years and years, learning what is happening with the patients, right? And so they see problems firsthand, and they can also come up with solutions. The problem with a physician coming up with a solution is they may implement in their department, it may or may not survive, but it's impossible to get that solution out into the world where it may help many millions of patients. And so that's when I decided that, okay, so if we can train physicians and other healthcare people on how to do innovation, on how to do entrepreneurship, build a community around to support them, create a platform to highlight the work that physicians are doing day in and day out, maybe bring in resources, maybe bring in investors, bring in people who may be able to help this person or team of persons to build what they're planning to do. And so that was the idea behind InnovatorMD. And I'm proud to say that, right now it's the largest physician innovation network in the country, probably in the world.
Yeah, and the Innovator Conference, MD conferences, quite close to JP Morgan, conferences. But I've seen the volume of physicians going to Innovator MD and the JP Morgan is almost equal, right? So
so there's a secret that everybody knows, which is the big conferences, they really don't care about physicians. The big conferences are after, either business side, the money side, the insurance side, that's where all the money is. So physicians become an afterthought. They're not, in the big scheme of things, in American healthcare, physicians are probably the last but one entity that gets recognized for the work. And so that problem is another problem that I'm trying to solve, is that if you think about patients and physicians, these are the two groups of people that are most important in healthcare. But patients and physicians are the last thing most of these businesses think about. And so how can we change that? And I'm glad your company is doing work with the patients. So if you think about the whole system, if you remove physician and patients, there's no healthcare system, right? I mean, you need these two for a healthcare system to function. And so we've built all these things around these people that this extra overhead is causing a lot of difficulty and pain and cost and all of those, poor quality, unnecessary procedures, unnecessary treatments, and the expense keeps going up. A lot of middlemen is what is causing this problem. So I want to go to the source, which is, on the physician side, trying to help them innovate so that they can make things better for patients.
Beautiful. And very, very rightly you said that healthcare system is created for patients, and the care is provided by the providers, the doctors. So on the other podcast, one of a provider and a thought leader and a healthcare leader, he very beautifully put one thing. The word healthcare is a compound word. Health care. Health is of patients, and care is given by the doctors. So to be honest, the system needs these two important pillars.
Yeah.
The rest is all around, should be around them, not as a part of a center. And unfortunately, that's what these big conferences, they made it very fancy, very big, but it is attracting more policymakers, the payers, and providers are just filling up the chairs.
Yeah.
So,
Exactly. We need to bring physicians to the top because, if you think about, the science behind medicine, right? It's the physicians who are doing that. It's the practice, and it's the delivery. It's all of those things that are important, in the cost quality equation.
Absolutely. And just to follow up on InnovatorMD a little bit, because you have very well explained why InnovatorMD, what's the purpose, and the name actually explains itself a lot. But if I would like to ask, how does the name InnovatorMD embody your vision? And if you can highlight a few key achievements that showcase its impact on healthcare innovation.
Sure. So InnovatorMD means that, physicians are seen as workers in the big system. They are just hourly workers, a unit workers, whether it is doing a procedure, doing this, doing that. And so the value of the physician when you talk about work, I think it is devalued. When you start thinking about physician as an innovator, then suddenly the value goes up because they have the power to change care, to improve care for millions of patients, right? Suddenly the value goes up. And so I wanted to focus on the scientist, on the inventor, on the entrepreneur side of physicians. So that word innovator embodies all of those things. The other piece is that, so we are not just valuing physicians for the work, how many appointments they see or how many surgeries they do. We are valuing them for their the thinking part, the creative part of the physician. And so to show that to physicians, even physicians themselves don't believe that they can make change happen. They can make things better. They can invent things because we have been, throughout our schooling, medical school, the residency, the fellowships, all is designed to be a worker. They're not, that's not designed to innovate, invent, and create new things. And so we want to change that mindset. And so we provide classes, master classes from experts, conferences. We do 2 big conferences a year. We do networking events, and we also do startup showcases. That is to showcase the work that these people are doing on the innovation side, so that we want to inform them and educate them, but also we want to inspire other people that are attending, other physicians. I've been doing this for 20 years, and so, I'm burnt out. Is this it for my life? Either do or get out. But we are showing that there's another path which is more invigorating, which is more exciting, so that they can bring more fun and excitement into their careers, right? You don't have to be a big inventor. You just do small things, and then slowly you will start enjoying it, and then it leads to bigger things. So that's the main purpose. We also run an accelerator in partnership with Founder Institute. We run 2 sessions every year, which is a 16-week course where each week we are tackling one issue of entrepreneurship. How do you start with an idea and end up with a company that is potentially fundable, that is potentially, revenue generating? And so that's the transformation people go through over a 16-week period. And we do 2 of those sessions in a year. And basically, the other problem physicians have is that they've been successful in most of the things that they do in their life. But entrepreneurship is very different. They think they can do it, but they need all the basic pieces in place before they become successful. And that's what we teach. I see about 150, 200 startups a year. And out of those, I pick 40 or 50 of them to invite them to come to our meetings to showcase. Out of those, I pick 1 or 2 companies to work with closely as an advisor or a mentor or an investor. And so that's how I can make my work life interesting, but also I can create something that has a greater impact in the future. So we have seen, over the last 5 years, we have seen several companies grow big. Of course, it is a high risk endeavor to start a company because majority of them don't work out. But these are learning experience, because the next company you're going to do, you will make sure that you don't make those mistakes and be more successful. But that's the nature of life in general, right? You learn and you get better and better at it. So that is the exciting part that we teach, and also we help promote.
Oh, and the Innovator MD takes physicians from around the world, right? So your accelerator program, does it take
Yes.
physicians from around the world?
Yeah, it's a virtual program. And so people from anywhere, not just physicians, but, nurses, pharmacists, even technologists, who have a physician or a nurse or some clinical person in their team can join this. That way they know that, okay, we have more than 100 mentors that will help them, go through these steps, help them with their thinking process, and also help them build this company that is, potentially marketable and fundable.
Wonderful. So I think, we will put the link to the Innovator MD page, because so that the audiences around the globe, the healthcare audience who want to make a change can have this opportunity to connect with your organization, and
Sure.
they can get some direction, and hand holding to make a difference. And one thing, what you mentioned resonated very closely to me. As a healthcare provider, or as a entrepreneur, a healthcare side, doctorpreneur is a new word we call it. We became entrepreneur to solve a problem in healthcare, which is close to us, right? But
Yeah.
then there's so many problems, right? The healthcare is it's so big, so wide, it's full of things to be made better. As one person, you cannot solve many problems, but each problem is impacting life. So that's another thing, for me, I have a company, a MediPocket, a cross-border care company, and that's my main focus on a problem-solving area for the international patients. But at the same time, I like to be part of other problems, solutions, and being an advisor, mentor, or roles like that help you to get attached to these problems and make a little impact in their bigger impact. So
Exactly.
that, as you said, it's refreshing, but it also gives you a little bit a kind of a bigger satisfaction that I'm not solving one problem, I'm actually part of few other problems that are impacting millions around the world.
Yeah,
So
especially somebody like you, let's say, you've gone through the journey of, becoming an entrepreneur. You know all the pitfalls, or all the challenges, the solutions too. And somebody who's starting off fresh may not know that. And so your advice and your mentorship is so important for so many people, and that make a big difference, instead of if the startup is going the wrong way, and then you help them pivot to a different destination, and that's very valuable. It's more valuable than money can buy.
And I think as a healthcare providers, as a physician, for us, what excites us is not the money part. That's a kind of a byproduct, right? What
Yeah.
excites us is the impact, the purpose. And again, we came for the service. We were brought here for the service, and that's where we find the ways to serve patients here and anywhere in the world. Now we go to a very interesting topic, which I am very interested to learn more about, is your Sirica Therapeutics.